Okay, what we're going to cover is the hip hinge movement. Now, hip hinge movement is really important for things in the gym like a deadlift, a Romanian deadlift, setting up for a box squat, hip thrusts, anything that involves the folding of the hips here, that is a hip hinge. Now, one of the most common things that hypermobile people have trouble with is identifying what is a hip hinge and what is a pelvic tilt. So we go through this kind of process of trying to identify, okay, if I'm hinging, am I hinging from here? Or am I just tilting my pelvis and rotating my pelvis forward and it kind of looks the same? If you're rotating your pelvis forward, then what's going to happen is you're actually jamming up the joints in your lower back, and that's going to become quite restricted, quite painful. It's putting your hamstrings on a lot of stretch, but in this position, it's going to feel like a lot of lower back is contributing because we're not actually getting any stabilization coming from the front through the lower abdominal. And we're not actually getting any hip hinging at all. We're just kind of getting this pelvic tilting, which looks like a hip hinge, but it's not. When we're talking about a hip hinge, we're talking about true hip hinge movement, hip flexion coming from here. This is the hip joint. This is the pelvis, hip joint. We want that hip to be going backwards. The hip goes backwards and the body falls forward. It's kind of like a pendulum, okay, like a pendulum effect. What you'll notice as well is that my knees and my shins stay relatively straight. They stay relatively vertical because what we want as well is for this movement to be a hip movement. If my knees let go first, then it becomes a squat. Okay, it's not truly a hip hinge movement. We're not really going to load up the glutes or the hamstrings if we are breaking at the knees first. So here's something you can do to help improve your hip hinge mechanics. You're going to get a broomstick, or like this is some kind of pergola hook type thing. You're going to pop this behind your back. You're going to place one hand on your sacrum, that's the base of your spine, right there at your tailbone, and one hand up here at your head. You're going to hold that pole against your body, and what you're going to do from here is you're going to send your hips backwards. You have to keep the pole attached to your body. And then what you should feel is a stretch reflex or some engagement happening through the hamstrings. Now, if you're a really hypermobile person, particularly through your hamstrings, probably not going to feel a lot happening in the hamstrings themselves. So what I really want you to focus on is keeping that stick or that pole attached to your back as you send your hips backwards so that your body falls forwards. Because what we don't want to see as well is this kind of thing happening where we're just bending our back forward, and that's just not going to be helpful for anyone's spine or anyone's glute muscles or anything really. We want to really focus on keeping the hands attached to the spine, so one at the head, one at the base of the spine, and we are sending the hips back. This is a true hip hinge motion. This is how we're going to improve things like your RDL, your deadlift, your hip thrusts, etc. So give that a go and let me know how you go.